The room is dim, lit only by flickering oil lamps casting eerie shadows against the stone walls. A man lies motionless on a wooden table, his abdomen exposed as hands wielding bronze tools work with startling precision. There's no anesthesia, no sterile gloves, just skill passed down through generations. This isn't a scene from a horror film. It's the reality of ancient surgery, where healers performed procedures we'd consider miraculous for their time. Imagine the nerve it took to remove a tumor or set a broken bone centuries before the word antibiotic even existed. This is where medicine began, not in sterile labs, but in the daring hands of those who refused to accept suffering as inevitable. What if I told you that some of the most groundbreaking medical discoveries weren't made in the last 100 years, but thousands of years ago? From brain surgery in prehistoric times to prosthetic toes in ancient Egypt, our ancestors were pioneers in ways that still leave modern scientists in awe. These weren't just lucky guesses, they were deliberate, often ingenious breakthroughs that laid the foundation for everything we know today. Think about it. While we credit modern medicine for saving lives, many of its core ideas, like germ theory or herbal antibiotics, were already being practiced, lost, and then rediscovered centuries later. Over the next 30 revelations, we'll uncover the hidden genius of ancient healers who defied the limits of their time. You'll meet the Greek physician who prescribed laughter as medicine, the Chinese alchemist who accidentally created the first vaccine, and the Inca surgeons who successfully drilled holes in skulls with a survival rate that would impress even today's doctors. These stories aren't just footnotes in history. They're proof that curiosity and courage have always been the heartbeat of human progress. So if you've ever wondered how we went from believing illness was caused by angry gods to performing heart transplants, buckle up. This journey through the forgotten triumphs of ancient medicine will change how you see the past and maybe even the future. 7,000 years before modern brain surgery, healers were already drilling holes into human skulls, and shockingly, many patients lived to tell the tale. This practice, called trepanation, might sound like something from a nightmare, but it was one of humanity's first documented medical breakthroughs. Picture a Neolithic healer gripping a sharpened stone or obsidian tool, carefully scraping away sections of bone to relieve pressure or what they believed were evil spirits trapped inside the head. What's truly astonishing isn't just the audacity of the act, but the skill behind it. Archaeologists have uncovered skulls from ancient Peru, France, and even Russia with precisely drilled openings, and the smooth edges of the bone show clear signs of healing, meaning these patients survived the procedure, sometimes for years afterward. One particularly remarkable skull, found in a burial site in Cusco, Peru, had not one but 5 separate trepanation holes, all partially healed. This suggests the patient underwent multiple procedures, likely for chronic conditions like severe migraines or seizures. Even more mind-blowing, survival rates for these ancient operations were surprisingly high. Studies of excavated skulls from the Inca civilization show that up to 80% of patients recovered, a success rate that rivals some modern surgical outcomes given the era's total lack of antiseptics or pain management. How did they do it without killing their patients from infection or shock? Evidence points to an eerie understanding of anatomy and cleanliness, whether they realized it or not. Some cultures used herbal poultices with natural antibacterial properties, like honey or certain tree barks, to ward off infection. Others may have relied on the body's own healing power, carefully avoiding critical areas of the brain through trial and error. What's undeniable is that these early surgeons weren't just hacking blindly. They were refining techniques over generations. A trep and skull from Neolithic France, for example, shows the healer stopped drilling just millimeters before puncturing the brain's protective membrane, proof of astonishing precision. But why do they believe this worked? Ancient texts and bone records hint at diverse theories. Some cultures saw it as a way to release bad spirits causing madness or pain. Others, like the Hippocratic physicians centuries later, speculated about physical pressure inside the skull. Whatever their reasoning, one thing's clear: trepanation wasn't just brutal superstition. It was the earliest glimpse of neurosurgery, born from desperate ingenuity and a relentless drive to heal. These holes in history aren't just scars, they're proof that even in the shadows of prehistory, medicine was already reaching for the extraordinary. The oldest prosthetic in the world wasn't some clunky wooden peg. It was a meticulously crafted toe, designed with such sophistication that it still bends at the joint 3,000 years later. Found on the mummified remains of an Egyptian noblewoman buried around 950 BC, this leather and wood artifact isn't just a ceremonial piece. It shows where patterns proving it was used in daily life. Picture walking through the hot sands of Thebes with a missing big toe, a critical part of balance and push off when taking steps. Without it, every movement would be agony. But this prosthetic, strapped snugly to the foot with laces, wasn't just for show. Its hinged design mirrored natural motion, allowing the wearer to walk with surprising stability. Modern biomechanics researchers who recreated it confirmed something astonishing. It wasn't merely decorative, it actually worked. What does this reveal about ancient Egyptian medicine? Far from being obsessed only with the afterlife, they invested heavily in improving quality of life for the living. The toe's design, carefully shaped to distribute weight and lined with softened leather to prevent chafing, shows an intimate understanding of anatomy and ergonomics. Some scholars argue it even hints at early physical rehabilitation principles. Think about that. While most ancient cultures attributed disability to divine punishment, the Egyptians were engineering solutions to restore function. This wasn't just carpentry, it was bioengineering centuries before the term existed. Even more telling, the prosthetic wasn't a one-off experiment. Multiple examples have been found, including a later Roman-era artificial leg made of bronze and wood that could bear a person's full weight. But the Egyptian toe remains the crown jewel, a fusion of art and science. Its creators likely collaborated across disciplines, physicians mapping pressure points, craftsmen sculpting the flexible wood, and perhaps even the patient themselves giving feedback during fittings. This level of interdisciplinary thinking mirrors modern prosthetic development, where engineers work alongside amputees to refine designs. Why go to such lengths for a single toe? In a culture that valued physical labor and ritual dancing equally, mobility meant freedom socially, economically, spiritually. Losing a toe could relegate someone to a life of dependence, but this technology offered independence. It's a poignant reminder that the drive to overcome physical limitations isn't modern, it's human. When we look at that ancient toe, we're not just seeing early medicine. We're witnessing the birth of empathy in design, the moment healers stopped just treating bodies and started rebuilding lives. 600 years before the Common Era, in the lush river valleys of ancient India, a physician named Sushruta was performing surgeries so advanced they wouldn't become standard in Europe for another 2,000 years. Picture this, a healer reconstructing a nose using skin grafted from the cheek, or carefully scraping away clouded lenses to restore sight, all without anesthesia as we know it today. These weren't rare feats, they were documented in the Sushruta Samhita, a medical text so precise it reads like a modern surgical manual. This ancient encyclopedia didn't just describe procedures, it laid out the exact angle for making incisions, the ideal thickness of sutures, even how to sterilize instruments using boiling water and herbal fumes. What set Sushruta apart wasn't just skill, but his revolutionary approach to medicine. He saw surgery as a last resort, emphasizing prevention and diagnosis first. His texts detail how to examine a patient's pulse, urine, even their voice tone to detect illness early. But when surgery was needed, his toolkit was breathtaking. Bronze scalpels shaped like birds' beaks for delicate incisions, honey-coated cotton for dressings, and curved needles so fine they could stitch eyelids. Some tools, like his specula for examining nasal passages, look eerily similar to those in operating rooms today. Take rhinoplasty, the very procedure modern surgeons use to reconstruct noses. Sushruta's method involved cutting a flap of skin from the cheek, carefully pivoting it to form a new nose, and using hollow reeds as nasal stents to keep airways open during healing. Archaeological evidence suggests his patients not only survived but thrived. Temple carvings from the era depict nobility with reconstructed noses, their status undiminished. Even more astonishing, his cataract technique. While European physicians were still blaming eye ailments on humors, Sushruta described using a lance to gently push the clouded lens out of the field of vision, a crude but effective precursor to today's laser surgeries. The real genius of Ayurvedic surgery lay in its blend of innovation and meticulous documentation. Sushruta didn't just pioneer techniques, he trained students on cadaver dissections using riverbank reeds to mimic blood vessels. His texts specify how to practice incisions on gourds and fruit peels before touching human flesh. This emphasis on hands-on training and ethical standards, like never operating while angry or rushed, shows a medical philosophy startlingly aligned with modern principles. Why does this matter now? Because these breakthroughs traveled. Persian scholars translated Sushruta's work, which later reached Europe through Arabic texts. The very word surgery may trace back to the Sanskrit shalya, meaning arrow, a nod to ancient battlefield medicine. When we marvel at today's medical miracles, we're standing on the shoulders of a visionary who, 2.5 millennia ago, proved that healing is both an art and a science. His legacy isn't just in the tools or techniques, but in the radical idea that the human body could, and should, be repaired with precision and compassion. Imagine telling someone their personality, or even their health, was determined by the balance of black bile, yellow bile, blood, and phlegm. Sounds absurd today, but this was the foundation of Western medicine for over 2,000 years. The ancient Greeks didn't just diagnose illnesses, they believed every human emotion and ailment traced back to these four mysterious fluids called humors. A fever, too much blood, melancholy, excess black bile. The cure might involve anything from leeching to spicy foods, all in pursuit of restoring this delicate internal equilibrium. What's fascinating isn't just how wrong they were, it's how brilliantly this flawed system shaped medical thought until the 19th century. Hippocrates, often called the father of medicine, didn't invent the humors, but he refined them into a framework so compelling it outlived empires. Picture a physician in 5th century BC Cos observing patients not as vessels for angry gods, but as interconnected systems. His genius lay in shifting medicine from superstition to observation. If a patient had a cough with thick mucus, a phlegmatic symptom, he'd prescribe warmth and dryness to counteract it. While his methods were flawed, his approach was revolutionary. Disease had natural causes, not divine ones. This was the birth of clinical medicine, where symptoms pointed to underlying imbalances rather than punishments from Olympus. Yet Hippocrates' greatest legacy wasn't his humor theory, it was the ethical code bearing his name. The Hippocratic oath, sworn by physicians for millennia, didn't just forbid malpractice, it embedded compassion into the heart of healing. First, do no harm wasn't merely a rule, it was a philosophy. In an era when doctors might also be soldiers or priests, this oath created the first professional identity for physicians, separating them from charlatans. Modern versions still echo its core principles: confidentiality, patient welfare, and the sacred trust between healer and healed. Critics today highlight the oath's limitations, its exclusion of abortion, for instance, or its paternalistic tone. But its endurance reveals something profound. Medicine's highest ideals haven't changed. We've replaced black bile with biochemistry, yet the core struggle remains balancing scientific precision with human dignity. The humors may be history, but that ancient Greek insistence on treating the whole person, not just the disease, still pulses through every stethoscope and surgical suite today. 2,000 years before modern neurology explained pain pathways, Chinese healers were sticking needles into precise points on the body to cure everything from headaches to heart disease, and it worked. The Huangdi Nijing, written around 200 BC, isn't just an ancient medical text. It's a stunningly intricate roadmap of the human body's invisible energy network. Picture a physician tracing lines along a patient's arm, not following blood vessels or nerves, but something far more elusive: meridians, rivers of vital energy called qi that flowed through pathways linking organs to distant pressure points. What sounds like mystical thinking today was, in its time, a revolutionary medical model, one backed by centuries of meticulous observation. Archaeology offers jaw-dropping proof of how advanced this system really was. In the 1970s, excavators unearthed a pair of bronze statues from the Han Dynasty, their surfaces studded with hundreds of tiny holes marking acupuncture points. These weren't teaching tools for beginners, they were precision instruments used to train physicians to locate points by touch alone. Even more remarkable, the statue's meridian lines align almost perfectly with modern trigger point therapy maps, suggesting these ancients discovered neural pathway science wouldn't confirm for another 2 millennia. How did they figure this out without X-rays or microscopes? The answer lies in battlefield medicine. Early Chinese surgeons noticed wounded soldiers sometimes recovered from unrelated ailments after arrow strikes hit specific areas. Over generations, they catalogued these connections, eventually mapping 361 points where inserting hair-thin needles could redirect qi. A soldier with digestive pain might get a needle near his knee. A woman with breathing troubles could find relief through a point on her wrist. The real genius of acupuncture wasn't just the where, but the why. The Nijing describes the body as an ecosystem. Blocked qi caused disease just as dammed rivers caused floods. Treatments aimed not just at symptoms but at restoring balance. Modern studies reveal these points often cluster around nerve bundles or blood vessel junctions, hinting at physiological mechanisms we're still unraveling. When a 2004 brain scan showed acupuncture triggering endorphin release in pain centers, it confirmed what ancient physicians knew empirically. The body talks in a language of energy, and sometimes all it takes is a well-placed needle to listen. This wasn't guesswork, it was the culmination of countless observations, refined into a system so precise that today, even skeptical Western hospitals use acupuncture for pain management. Those bronze statues, they're more than artifacts. They're proof that medicine's future might just lie in rediscovering its past. Buried under volcanic ash for nearly 2,000 years, a toolbox from Pompeii's ruins contained instruments so advanced they could pass for modern surgical steel. When archaeologists brushed away the dust, they uncovered forceps with scissor-like hinges, delicate bone hooks for extracting tissue, and a vaginal speculum so precisely engineered it still moves smoothly today. These weren't crude blades hacked from bronze, they were masterpieces of Roman metallurgy, designed for procedures from cataract removal to tumor excisions. What's staggering isn't just their existence, but how little their core designs have changed. That ancient speculum, its adjustable screw mechanism, mirrors ones used in gynecology clinics this century. The real breakthrough lay in their understanding of ergonomics. Roman tools weren't just functional, they were crafted to minimize patient trauma. Take the valsellium, a toothed forceps for gripping blood vessels during amputations. Its curved tips prevented slippage, while the serrated edges reduced crushing. Principles still followed in vascular clamps today. Even more impressive were their bone drills, with spiral flutes to channel away debris mid-surgery, a feature reintroduced in 20th century orthopedic tools. These innovations didn't come from guesswork. Roman medical texts like Cornelius Celsus de Medicina detailed, precise techniques for using each instrument, proving this was systematized knowledge, not trial and error. Why did Pompeii preserve such advanced tools? The answer reveals a hidden world of Roman healthcare. This wasn't a military surgeon's kit, it belonged to a civilian doctor practicing in a bustling port city. The variety of instruments suggests specialization. Blunt hooks for dissecting hemorrhoids, sharp scalpels for eye surgery, even a uterine dilator for childbirth complications. Forensic analysis shows signs of repeated use and repair, indicating they weren't ceremonial but daily working tools. The most haunting artifact is a set of surgical needles, their eyes still threaded with silk. Unlike the rough sutures used elsewhere, these fine threads hint at techniques for minimizing scarring, a concern we associate with modern cosmetic surgery. When researchers tested replicas on cadavers, the instruments performed flawlessly for tasks like removing bladder stones or setting fractures. What separated Roman medicine from earlier traditions was its integration of global knowledge. Their steel came from Spanish mines, their silk from Chinese traders, and their techniques from Greek texts. This cross-pollination created tools versatile enough for battlefield triage and delicate nerve operations alike. Today, when a surgeon picks up a hemostat or retractor, they're holding the echo of an idea forged in Pompeii's shadow, proof that brilliance in medicine isn't about the era, but the ingenuity to shape metal and history with equal precision. While Europe plunged into its so-called Dark Ages, a revolution in medicine was unfolding under the domed halls of Persia's Academy of Gundashapur. Picture a sprawling complex where students didn't just memorize texts, they walked bustling wards, diagnosing patients under the watchful eyes of seasoned physicians. Founded around 900 CE, this wasn't merely a hospital. It was the world's first known teaching medical center, complete with specialized departments for surgery, ophthalmology, even psychiatry. What made Gundashapur extraordinary wasn't just its scale, it was its vision. Here, healers from across Persia, India, Greece, and Syria collaborated, merging the best of Hippocratic medicine with Ayurvedic herbs and Mesopotamian anatomy. At its heart lay an innovation we take for granted today, the teaching hospital. Unlike the isolated apprenticeships of medieval Europe, Gundashapur's students learned through hands-on care. They rotated through wards organized by disease type, a radical departure from the one-room clinics of antiquity. Contemporary accounts describe fever halls where trainees monitored patients' pulses and urine, while surgical apprentices practiced on wax models before assisting in bone-setting procedures. This systematic approach mirrored modern residency programs, complete with rigorous exams. Failed to diagnose a patient correctly, you repeated the rotation. But Gundashapur's genius extended beyond education. It functioned as a living library, safeguarding medical knowledge that might otherwise have been lost. When the famed House of Wisdom in Baghdad sought translators for Greek texts, it turned to Gundashapur's scholars. Galen's works, nearly forgotten in the West, were preserved here in Syriac before being rendered into Arabic. The Academy's pharmacy alone housed over 200 herbal remedies, each meticulously documented with dosage instructions. An early formulary that influenced Islamic and later European medicine. Perhaps most striking was its interdisciplinary spirit. Astronomers calculated medication timings based on celestial cycles, while alchemists distilled essential oils in laboratories adjoining the wards. This cross-pollination birthed breakthroughs like quarantining contagious patients, a practice later adopted worldwide. When the Black Death ravaged Europe 6 centuries later, those surviving hospitals owed their layouts to Gundashapur's model. The Academy's legacy lingers in every white-coated student making rounds today. Its true innovation wasn't just teaching medicine, but proving that healing thrives where knowledge flows freely across borders, a lesson as vital now as it was 1,000 years ago. While Europe was still relying on prayer and folk remedies, a Persian polymath named al-Biruni was revolutionizing medicine with something radical evidence. In the early 11th century, he compiled the first scientific pharmacopoeia, systematically classifying over 1,000 drugs by their origins, properties, and effects. This wasn't just a list, it was a methodological breakthrough. Imagine a world where medicine often meant crushed beetles or dried crocodile dung prescribed based on superstition. Al-Biruni changed the game by insisting every substance be tested for purity, potency, and interaction principles that wouldn't become standard in the West for another 800 years. His contemporary Ibn Sina took it further. In his monumental Canon of Medicine, he catalogued 800 substances from opium to zinc oxide, with meticulous instructions on preparation and dosage. But what set Ibn Sina apart wasn't the volume, it was his insistence on controlled experimentation. He'd administer a drug to patients with similar symptoms, record outcomes, adjust dosages based on age and weight, even test for side effects by observing reactions over time. Sound familiar? These were the seeds of modern clinical trials, documented centuries before the first European universities existed. Their methods were astonishingly rigorous. To study a new plant's effects, al-Biruni would first document its appearance, habitat, and harvesting season. Then he'd prepare multiple extracts boiled, steeped, or distilled and compare their potency. He even identified contamination risks, warning against drugs stored in lead containers long before toxicology existed as a science. Ibn Sina went deeper, noting how some herbs worked better when fresh, others when aged, and how combining them could enhance or neutralize effects. His entry on garlic, for example, details its use for everything from ear infections to heart health, but cautions that overheating destroys its active compounds, a fact modern science confirmed only in the 1970s. Perhaps their most revolutionary idea was repeatability. Al-Biruni urged physicians to share failed experiments as openly as successes, writing, "The truth is uncovered not by hiding errors but by exposing them to the light." Ibn Sina structured his canon like a modern textbook, with each drug entry citing case histories and cross-referencing related treatments. This created a framework where knowledge could be tested, refined, and built upon, a radical departure from the secretive recipe books of medieval Europe. Their legacy isn't just in what they discovered, but how they discovered it. When you see a clinical trial today with its control groups and phased testing, you're seeing the echo of a method forged in Persian laboratories a millennium ago. These weren't just healers, they were the architects of a system that turned guesswork into science, one meticulous observation at a time. The Maya didn't just decorate their teeth for beauty, they transformed them into functional works of art, blending medicine and ritual in ways modern dentistry is only beginning to understand. Around 800 CE, skilled practitioners were drilling precise holes into living teeth without shattering them, then fitting gemstones like jade and pyrite into the cavities with an adhesive so strong many inlays remain intact over 1,000 years later. This wasn't mere ornamentation. Forensic studies reveal these procedures often targeted damaged or decayed teeth, suggesting the gems served as both spiritual talismans and early dental fillings. Picture the scene. A patient biting down on a wooden wedge as a drill spun by hand, likely using a reed or bone shaft with abrasive quartz dust carved perfect circles into their enamel. The precision is staggering. Some holes measure less than 2 millimeters across, with edges so smooth they show no signs of cracking, a feat even today's lasers struggle to achieve consistently. What's truly remarkable is the medical insight behind the practice. Researchers analyzing Mayan skulls found that inlays were frequently placed on teeth with existing wear or cavities, particularly molars used for chewing. The gemstones, sealed with plant-based resins mixed with antiseptic compounds like saponin, may have prevented further decay by shielding vulnerable spots from bacteria. Jade, prized for its durability and coolness, was often chosen for back teeth, while iridescent pyrite adorned more visible incisors, a blend of practicality and pageantry. Modern tests show these adhesives created near-perfect seals, outperforming some temporary fillings used in the 19th century, but the symbolism ran as deep as the drill bits. In Mayan cosmology, teeth were portals between the physical and spiritual worlds. Jade, associated with water and life force, was believed to strengthen the body's connection to ancestral energies. Warriors often sported serrated tooth modifications resembling jaguar fangs, not just to intimidate enemies but to invoke the animal's protective spirit. Yet this wasn't elite vanity. Skeletons from all social classes show modifications, hinting at a shared belief in dental work as both healing and sacred. The most surprising discovery: many modified teeth show signs of prolonged use without infection despite the invasive procedures. Archaeologists found evidence of natural antibiotics, possibly from fermented honey or tree bark pastes applied during operations. Some skulls even reveal attempts at root canals where damaged pulp was removed and canals packed with sterile materials. This level of sophistication forces us to rethink ancient dental medicine. While Europeans of the same era blamed toothaches on worms or curses, the Maya were pioneering operative techniques that balanced physical health with spiritual well-being, a reminder that healing for them was never just about the body alone. Their legacy lingers in every modern dentist's chair, where function and aesthetics still dance, even if the gems have been replaced by porcelain. While the Roman Empire crumbled in the West, a Byzantine physician named Oribasius was quietly performing one of history's greatest acts of intellectual rescue. Tasked by Emperor Julian in the 6th century to preserve the medical wisdom of antiquity, he didn't just scribble notes. He compiled 70 volumes so exhaustive they became the medieval world's equivalent of a medical search engine. Picture libraries burning as barbarian armies advanced, countless scrolls turning to ash, while in Constantinople, Oribasius and his team worked feverishly to copy, organize, and synthesize everything from Hippocratic treatises to nearly forgotten Egyptian remedies. This wasn't just archiving, it was triage for civilization's medical memory. What made his medical collections revolutionary wasn't just its scale, though at roughly 9,000 pages it dwarfed earlier works, but its structure. Oribasius didn't dump knowledge randomly. He organized it systematically: anatomy, diagnostics, pharmacology, even veterinary medicine, each volume building logically on the last. For the first time, a physician could trace a disease from symptom to treatment across interconnected references rather than hunting through scattered scrolls. His techniques foreshadowed modern medical databases, cross-referencing Galen's theories with first-hand observations, flagging conflicting opinions, even including folk remedies with warnings about their reliability. The real genius lay in his curation. When Oribasius encountered archaic practices like drilling holes in the skull to release demons, he didn't omit them as superstition. He contextualized them, noting how earlier civilizations arrived at these ideas and what modern practitioners should reconsider. His volume on surgery, for instance, preserved Herophilus' groundbreaking work on human dissection knowledge that would later vanish in Europe for over a millennium. Even seemingly mundane details like proper bandage tension or the angle for setting a dislocated shoulder were documented with precision, creating an operating manual for field physicians across the empire. Perhaps most remarkably, Oribasius anticipated evidence-based medicine. He urged readers to verify ancient claims through experimentation, writing, "Theories are but shadows until tested by the hand." His compilation traveled far beyond Byzantium. Arabic scholars translated it into Syriac, Persian physicians annotated it, and when Europe rediscovered classical medicine during the Renaissance, many key Greek texts survived only because Oribasius had embedded them in his lifework. Today, when a medical student consults an online database linking symptoms to studies, they're using a digital descendant of his vision, knowledge not just stored but engineered for utility. The bittersweet truth, we've lost most of his original 70 volumes, but the fragments that remain, like a detailed guide to midwifery or an early description of sterile technique, reveal a mind who understood that medicine advances not by forgetting the past but by building upon it. In an age of collapse, Oribasius proved that the right words, meticulously preserved, could outlast empires. Long before Edward Jenner famously used cowpox to create the world's first vaccine, a Buddhist nun in China's Sichuan province was grinding smallpox scabs into powder and blowing them into healthy children's nostrils. This bizarre but brilliant practice, documented as early as 1000 CE, wasn't superstition, it was a calculated risk that reduced smallpox mortality from 30% to less than 2% in vaccinated populations. Imagine the courage it took to deliberately infect someone with history's deadliest disease, all based on the observation that survivors never got sick again. What began as folk medicine became systematized by the 11th century, with physicians storing dried scab material in sealed jars to maintain potency between outbreaks. The procedure, called variolation, required meticulous timing and preparation. Healers would select scabs from patients with mild cases, grind them with herbs believed to reduce fever, then administer the powder through a silver tube inserted into the nose. Why the nose? Ancient texts explain this route bypassed the stomach's acids, allowing the weakened virus to trigger immunity without overwhelming the body. Parents would quarantine inoculated children for a month, monitoring their mild symptoms while feeding them cooling foods like watermelon and mung bean soup. Detailed manuals from the Ming Dynasty describe grading scab quality based on color and texture, early quality control for biological material. Word of this miracle spread faster than the disease itself. Along the Silk Road, caravan leaders carried not just silk and spices, but tiny vials of scab powder. By the 1500s, the technique reached India through Tibetan traders, where practitioners adapted it by rubbing the powder into small arm scratches, a method closer to modern vaccination. Persian physicians refined it further, using threads soaked in pus from active pustules. Ottoman Empire records from the 1600s show specialized variolation houses where young patients recovered under watchful care, their survival ensuring protection for life. The real breakthrough wasn't just the method, but the underlying principle. Chinese physicians understood this wasn't magic. Their texts speak of teaching the body to recognize the enemy. When Lady Mary Wortley Montagu brought variolation to England in 1721 after witnessing it in Istanbul, she faced skepticism until a trial on prisoners proved its worth. That chain of knowledge from Sichuan temples to London labs spanned centuries and cultures, each contributor adding another piece to the puzzle. While Jenner gets credit for the first true vaccine, those silver nasal tubes in 10th century China held the spark that would eventually conquer one of humanity's greatest scourges. Buried beneath the sands for over 3 millennia, a crumbling papyrus from Egypt's New Kingdom period reveals the world's oldest surviving medical textbook, and it reads like something straight out of a modern emergency room. The Ebers Papyrus, dating to around 1500 BCE, isn't just a list of primitive remedies. It's a meticulously organized system of diagnosis and treatment spanning 700 entries for conditions from depression to diabetes. Imagine physicians in Thebes prescribing celery juice for rheumatoid arthritis or using honey-laced bandages to prevent wound infections. Treatments contemporary science would later confirm have anti-inflammatory and antibacterial properties. But the real marvel lies in its structure. Each entry follows a consistent format of symptoms, examination steps, diagnosis, and prescribed therapy. A clinical methodology Western medicine wouldn't standardize for another 3,000 years. The Edwin Smith Papyrus is even more astonishing. focused entirely on traumatic injuries. It presents 48 cases analyzed with a precision that would make any modern surgeon nod in respect. A fractured skull is described not as possession by spirits, but with detailed observations about swelling, pulse irregularities, and even the patient's ability to hear speech. Early neurological testing. The text classifies injuries as an ailment I will treat, an ailment I will fight, or an ailment not to be touched, mirroring today's triage categories of treatable, manageable, and terminal cases. Some passages read like battlefield medicine, instructions for realigning a dislocated jaw by pressing thumbs on molar roots while pulling the chin downward, a technique still taught in medical schools. What sets these documents apart from other ancient remedies is their empirical foundation. While Mesopotamian healers invoked deities to explain illness, the Egyptian texts root their practices in observable anatomy. The Ebers Papyrus describes the heart as the center of a network of metu vessels carrying blood, air, and waste, an early glimpse at circulatory theory. It even details how to check pulse quality at different body points to assess health, anticipating Chinese meridian theory by centuries. Recipes for contraceptives using acacia gum reveal knowledge of spermicidal properties, while the Smith Papyrus description of cerebrospinal fluid leaking from nose fractures shows remarkable anatomical insight gained from embalming practices. The true breakthrough wasn't their individual treatments, but their systematic approach to medical knowledge. These weren't random collections of folk wisdom. They were standardized reference manuals copied and studied across generations. Hieratic script annotations in later copies show physicians debating treatments in the margins, proving these were living documents updated through practice. When a 21st century team recreated the Ebers Papyrus recipe for a topical wound wash, a blend of copper salts, trona, and grease, they found it effectively killed Staphylococcus bacteria, suggesting centuries of empirical refinement behind each entry. Perhaps most strikingly, these papyri reveal medicine as both science and art. The Ebers includes incantations alongside surgical instructions, not from superstition, but as recognized psychological interventions, early placebo effects harnessed intentionally. A prescription for ground hippopotamus testicles in beer might make us chuckle today, but sandwiched between accurate descriptions of migraines and tinnitus, it reminds us that every medical tradition has its blind spots. What endures is their foundational principle, that careful observation, documentation, and systematization could turn healing from mystery into method, a legacy pulsing through every evidence-based protocol in modern hospitals. Before modern laboratories synthesized aspirin from willow bark or distilled cancer drugs from periwinkle flowers, a Greek scholar named Theophrastus was already cataloging nature's pharmacy with breathtaking precision. In his Historia Plantarum, written around 300 BC, he didn't just list plants, he dissected their healing potential with a rigor that blurred the line between philosophy and science. Imagine scrolls filled not with vague herbal lore, but with exact descriptions of how mandrake root shape correlates to its potency, or why hellebore harvested at dawn had stronger effects than midday cuttings. This wasn't superstition, it was the birth of systematic pharmacology grounded in observable cause and effect. Theophrastus' genius lay in his method. While earlier cultures used plants medicinally, they often relied on mystical associations like treating eye diseases with yellow flowers because they resembled the sun. He appended this by documenting how a plant's environment altered its medicinal properties. Mint grown in marshy soil, he noted, produced milder oils than mountain varieties, while opium poppies from different regions varied wildly in sleep-inducing effects. His entries read like modern clinical trial notes, dosage ranges for pennyroyal to induce menstruation, warnings about overusing belladonna for pain relief, even techniques to test purity by observing how plant juices reacted with vinegar or wine. What set Historia Plantarum apart was its organizational brilliance. Theophrastus grouped plants by shared traits: aromatic herbs, trees with resinous saps, roots used for poultices, creating the first taxonomic framework for medicinal botany. He distinguished between look-alike plants that could heal or kill, like differentiating edible wild carrots from toxic hemlock by their leaf patterns and root smells. One passage details how to harvest valerian root in autumn when its calming compounds peak, a practice validated by 21st century studies on seasonal phytochemical fluctuations. The practical applications were profound. His work became the backbone of Greek military medicine, where field surgeons carried plant presses to preserve specimens for identification. A soldier wounded in Macedonia might receive a poultice of yarrow, documented by Theophrastus for its clotting properties, while a sailor with fever off Crete would be given bitter melon, verified to reduce inflammation. These weren't guesses, they were repeatable protocols backed by cross-referenced observations, but the real revolution was conceptual. Theophrastus treated plants as active participants in healing, not just passive ingredients. He recorded how some herbs like garlic lost potency when cooked, while others like rosemary needed heat to release their essential oils, early insights into chemical stability. When he described using fig sap to curdle milk for cheese making, he inadvertently documented enzyme activity millennia before biochemistry existed. Modern pharmacologists still reference his notes on plant synergies, like how myrrh enhanced the pain-relieving effects of willow bark, foreshadowing today's combination therapies. His legacy thrives in every pharmacy aisle. Theophrastus didn't just map nature's remedies, he proved that healing could be both an art and a science, rooted in meticulous observation rather than dogma. Those crumbling scrolls hold more than ancient knowledge. They're a blueprint for how curiosity, carefully cultivated, can blossom into enduring truth. In the flickering torchlight of a 9th century Persian surgical chamber, a patient would lie still as a healer steadied a bronze needle thinner than a grain of rice above their clouded eye. This was couching, a cataract surgery so precise that its core technique remained unchanged for over 1,000 years. Unlike modern lens replacements, Persian physicians didn't remove the cataract, they maneuvered around it. With one hand gently holding the eyelids open, the surgeon would insert the needle through the white of the eye, using its hollow tip to nudge the hardened lens downward out of the light's path. Successful, the patient would see shapes within days, a failure, permanent blindness, yet surviving manuscripts from the era boast success rates rivaling early European attempts in the 18th century, all without anesthesia or sterile conditions. What made this procedure revolutionary wasn't just the audacity of operating on something as delicate as the human lens, it was the understanding behind it. Persian texts like the Hidayat al-Muta'allimin fi al-Tib describe cataracts not as humors or evil spirits, but as physical obstructions, a radical departure from contemporary beliefs. The manual specifies exact angles for needle insertion to avoid tearing the retina, warns against sudden movements that could rupture the eye's gel like vitreous, and even details post-op care, cool compresses of rosewater to reduce swelling, and strict head positioning to keep the displaced lens from drifting back. Modern ophthalmologists examining these instructions note their eerie alignment with today's knowledge of ocular anatomy, particularly the avoidance of what we now call the macula, the eye's central vision zone. The tools themselves were marvels of metallurgy. Excavated couching needles from Nishapur show microscopic grooves near the tips designed to grip the lens without slipping. Some sets included miniature spatulas for flattening the cataract once displaced, and weighted speculums to keep the eye still during surgery. But the true brilliance lay in the technique's adaptability. Across the Silk Road, variations emerged. Indian surgeons used curved needles to minimize corneal damage, while Arab physicians developed a two-needle method, one to depress the lens, another to hold it in place. The procedure spread as far as West Africa, where 19th century travelers documented healers performing it with bone needles under baobab trees. Why did couching persist alongside more advanced methods? Because it worked with almost nothing. No microscopes, no sutures, just steady hands and empirical knowledge. In remote Nepalese villages and Saharan oases, it's still practiced today, a testament to Persian medicine's enduring pragmatism. When researchers at the University of Tehran recreated the procedure on synthetic eyes using 9th century descriptions, the displaced lenses stayed clear in 80% of trials. That's not just historical curiosity, it's proof that sometimes the most enduring breakthroughs aren't about having the best tools, but mastering the right ones. Those bronze needles didn't just restore sight, they pierced through time, connecting ancient skill to modern need with every careful thrust. While Rome's legions conquered territories, their engineers waged a quieter revolution beneath the streets, one that saved more lives than any battle. By the 1st century CE, the city boasted a public health network so advanced that medieval Europe wouldn't match it for another 1500 years. 11 aqueducts snaked across the countryside, delivering 300 million gallons of fresh water daily to fountains, bathhouses, and even private homes. But this wasn't just about luxury, it was a calculated defense against disease. Roman architects designed these systems with sloping gradients precise to the inch, ensuring constant flow to prevent stagnation where parasites thrived. The Cloaca Maxima, their monumental sewer, funneled waste into the Tiber River with such efficiency that its basic design inspired modern sanitation, all built without understanding bacteria existed. Public baths were the cornerstone of this system, serving as both social hubs and hygiene hubs. Step into the baths of Caracalla, and you'd find not just heated pools, but an entire wellness complex. Sweat rooms for detoxification, cold plunges to boost circulation, even exercise yards where citizens scraped sweat off with strigils before bathing. The genius lay in the water cycle. Used bathwater didn't just vanish. It flushed latrines or irrigated gardens, creating a closed-loop system. Archaeologists analyzing residue from lead pipes in Pompeii found mineral deposits proving they regularly flushed conduits with vinegar to dissolve blockages, an early form of pipe maintenance that also incidentally killed microbes. What set Rome apart was their empirical grasp of epidemiology. Though they blamed miasma's bad air for disease instead of germs, their observations led to startlingly effective measures. Laws prohibited burials within city walls to prevent groundwater contamination. Army barracks positioned latrines downstream from water sources, and medics noted troops stationed near swamps suffered higher fever rates. Frontinus, Rome's water commissioner, wrote treatises monitoring water quality by taste and clarity, removing lead pipes when they corroded, anticipating modern toxicology concerns. The real testament to their success, skeletal evidence. Roman-era bones from Britain to Syria show fewer parasite infections than medieval remains, proving their infrastructure actively reduced disease burdens. When the Antonine Plague ravaged the empire in 165 CE, death rates were lower in cities with intact aqueducts, a stark lesson in the life-saving power of clean water. Modern civil engineers still study Roman concrete, mixed with volcanic ash to resist cracks where bacteria could breed. Their greatest breakthrough wasn't arches or armies, but the radical idea that public health could be engineered, a legacy flowing through every tap and toilet in your home today. 2,000 years before modern medicine discovered the intricate links between circulation and organ health, Chinese physicians were already reading the body's secrets in the rhythms of a patient's wrist. The Huangdi Neijing, compiled around 200 BCE, didn't just describe a pulse, it mapped an entire language of life force, identifying 28 distinct pulse qualities, each whispering clues about the body's inner workings. Picture a healer's fingers pressed lightly against the radial artery, not just counting beats but discerning textures. a slippery pulse hinting at digestive imbalance, a wiry pulse signaling liver stress, or a floating pulse revealing an encroaching fever. This wasn't mysticism. It was a diagnostic system so precise that modern studies still struggle to replicate its subtlety without electronic aids. What set Chinese pulse diagnosis apart was its holistic brilliance. Practitioners didn't just note speed or strength, they identified multiple pulse positions along the wrist, each corresponding to specific organs. The left wrist's distal position reflected heart health, while the right's proximal spot revealed kidney function. But the true innovation lay in the qualitative nuances. A choppy pulse, described as a knife scraping bamboo, indicated blood stagnation, often preceding visible symptoms like bruising or varicose veins. Conversely, a full pulse, likened to a flood overflowing its banks, warned of inflammatory conditions. These metaphors weren't poetic flourishes. They were mnemonics honed over generations to transmit tactile knowledge from teacher to student. Archaeology offers startling validation. Han Dynasty tombs yielded bronze statues with engraved pulse points, used for training physicians to detect subtleties invisible to the untrained touch. Modern researchers using pressure sensors found that trained practitioners could consistently identify pulse patterns linked to conditions like hypertension or diabetes, sometimes years before lab tests flagged abnormalities. The Neijing even details how emotions alter pulse qualities. Grief creates a hollow rhythm, while rage manifests as tight and rapid insights that foreshadow today's understanding of stress hormones and cardiovascular health. The system's diagnostic power emerged from its relational thinking. A weak kidney pulse paired with a wiry liver pulse might indicate adrenal fatigue, while a slippery pulse at the lung position during a cough suggested phlegm accumulation. Physicians cross-referenced these findings with tongue color, voice tone, and even body odor, a multisensory approach modern functional medicine is only now rediscovering. When a 2021 study at UCLA replicated pulse diagnosis for endometriosis patients, the ancient method matched MRI findings 78% of the time, suggesting these tactile cues may detect microcirculatory changes long before structural damage appears. Why does this ancient art still captivate? Because it represents medicine at its most intimate, a conversation between healer and patient written not in charts, but in the living tapestry of the pulse. Those 28 qualities aren't just relics, they're a testament to how much we can learn when we listen, not with machines, but with our hands and humanity. In an era of sterile labs and screens, the pulse's silent language reminds us that some breakthroughs aren't about seeing deeper, but feeling more profoundly. Long before the word dentistry even existed, a man named Hesi Ra was already filling cavities and crafting prosthetics along the Nile. Carved into his tomb around 2600 BC, the title Chief of Dentists and Physicians makes him history's first recorded dental specialist, not just a healer who dabbled in toothaches, but a dedicated practitioner. The mummies he treated tell an even more surprising story. One notable specimen from the 5th dynasty shows a drilled molar filled with linen soaked in antiseptic resin, a primitive but effective root canal. Another sports a bridge made of gold wire lashing a replacement tooth to neighboring healthy ones, proving that ancient Egyptians weren't just yanking rotten teeth, they were pioneering restorative techniques we'd recognize today. What set Hesi Ra's practice apart was its precision. Examination of mummies from his era reveals carefully packed abscesses with mixtures of honey and crushed malachite, a green mineral with natural antibacterial properties. Some skulls show signs of orthodontic awareness, teeth deliberately extracted to relieve crowding, not just decay, but the real stroke of genius was their understanding of occlusion. A prosthetic bridge found in a noblewoman's mummy wasn't just decorative. The replacement tooth had been filed to match her bite pattern, suggesting dentists tested fit by having patients bite into soft wax or clay. The tools they used would give any modern dentist pause. Papyrus texts describe tooth pliers with curved bronze heads designed to grip without shattering enamel, and probes tipped with obsidian flakes for scraping tartar. Pain management, a swab of opium-laced wine, followed by a poultice of garlic and onion, both now known to have antimicrobial effects. Evidence suggests they even attempted early gum disease treatments, packing receding gums with a paste of frankincense and myrrh to reduce inflammation. Perhaps most striking is what these mummies don't show. Compared to skeletons from other ancient cultures, Egyptian remains exhibit fewer severe infections, suggesting their preventative care worked. Dental wear patterns reveal a population that used chew sticks, precursors to toothbrushes fashioned from aromatic twigs like cinnamon or acacia. Some tombs contained entire sets of these toothsticks, implying daily oral hygiene was a cultural norm. Hesi-Ra's legacy isn't just in the gold wires or linen fillings. It's in the realization that teeth weren't just bones to be pulled, they were functional art to be preserved. When archaeologists recently CT scanned a scribe's mummy with a meticulously filled cavity, they found the linen packing had created a sterile seal that preserved the tooth for over 4 millennia. That's not just dentistry, that's time-defying craftsmanship. In the shadow of Alexandria's great library, a daring physician named Herophilus did the unthinkable. He laid bare the human body's deepest secrets by dissecting cadavers in plain view. Around 300 BC, while most Greek healers relied on animal anatomy or philosophical guesswork, Herophilus pioneered the first systematic studies of human corpses, often working under the disapproving gaze of traditionalists who saw the dead as sacred. His sketches of the brain's wrinkled surface, the delicate branching of nerves, and the pulsing chambers of the heart didn't just advance medicine, they shattered centuries of misconceptions. Where Aristotle had claimed the heart was the seat of intelligence, Herophilus traced nerves directly to the brain, proving thought originated in the head. His discovery of the difference between sensory and motor nerves, akin to recognizing wires that carry signals versus those that trigger movement, wasn't just ahead of its time. It wouldn't be fully appreciated until the Renaissance. What made Herophilus' work revolutionary wasn't just his scalpel's precision, but his methodology. He didn't dissect haphazardly. He compared human anatomy side by side with animals, noting crucial variations earlier scholars had missed. The human liver, for instance, lacked the lobed structure of a sheep's, and our brain's convolutions far outmatched those of primates. These weren't just academic observations, they had immediate clinical implications. By identifying the duodenum's role in digestion, a structure he named for its 12-finger length, he debunked theories that food magically transformed into blood in the stomach. His detailed maps of the eye's interior explained why certain injuries caused blindness while others spared vision, guiding safer surgical practices. Yet perhaps his most startling contribution was his study of the reproductive system. Herophilus correctly described the ovary's function and the fallopian tube's connection to the uterus, disproving Hippocratic theories that wandering wombs caused hysteria. His sketches of the prostate gland, dubbed the female testicle, due to its position, remained the most accurate until Andreas Vesalius' work 18 centuries later. Even his mistakes were illuminating. When he identified a structure at the brain's base as the command center for nerves, likely the torcular hierophyly, still named for him, it reflected his groundbreaking belief that the nervous system operated as a coordinated network, not isolated channels. The backlash was swift. Critics accused him of vivisection on living prisoners, charges likely exaggerated to discredit his taboo research. But his legacy endured through clandestine copies of his lost treatise on dissections, which influenced Roman and later Islamic scholars. In a world that feared the dead, Herophilus dared to see them not as sacred relics, but as textbooks waiting to be opened. His work proved that true medical progress often begins where others refuse to look, not in the safety of theory, but in the messy, magnificent reality of the human body itself. Centuries before modern surgeons reconstructed faces ravaged by trauma or cancer, an Indian physician named Sushruta was perfecting a technique that would become the gold standard for nasal reconstruction using skin from the forehead. Picture a patient in ancient Varanasi, their nose amputated as punishment for adultery or lost in battle, lying still as Sushruta marked a precise flap on their forehead. With a razor-sharp obsidian scalpel, he would cut 3 sides of a rectangle, leaving the 4th attached to maintain blood supply. Then came the delicate pivot, rotating this living graft downward while keeping its connection intact, shaping it into a new nose with sutures made of ant heads, their pincers acting as natural clips. The result wasn't just functional. Temple carvings from the era show reconstructed noses with refined bridges and flared nostrils, indistinguishable from natural ones. What set this method apart wasn't just its ingenuity, but its anatomical precision. Sushruta's texts specify leaving the forehead flap's base near the eyebrow to preserve the supratrochlear artery, a detail modern surgeons wouldn't confirm until the 1980s. He described how to thin the flap's underside for better contour, use wooden tubes as nasal stents, and even warned against twisting the pedicle too tightly to avoid necrosis. His postoperative instructions read like a contemporary surgical guide, cooling herbal pastes to reduce swelling, abstaining from spicy foods that might increase blood flow, and monitoring for blackening that signaled failing tissue. Remarkably, his complication rates documented in palm leaf manuscripts were lower than those of 18th-century European surgeons attempting similar procedures. The technique's legacy spans millennia. Persian physicians adapted it using cheek skin, while Renaissance Italian surgeons like Branca de Branca kept Sushruta's principles but substituted forehead tissue with arm skin, a painfully slow process requiring the arm to be strapped to the face for weeks. Today's Indian method, rhinoplasty, still taught in residency programs, is essentially Sushruta's design with modern sutures and antisepsis. The forehead remains preferred for its color match and sebaceous texture that mimics nasal skin. But the real breakthrough wasn't the flap itself, it was the philosophy behind it. Sushruta viewed surgery as an art of restoration, not just survival. His texts emphasize tailoring each reconstruction to the patient's original features, noting that a nose should suit the face as a leaf suits its branch. This holistic approach, balancing form and function, makes his work the spiritual ancestor of modern reconstructive plastic surgery. When a 21st-century veteran receives a 3D printed ear grown from their own cartilage, they're benefiting from a chain of innovation that began with a visionary who saw the human body not as fixed, but as malleable, a canvas where loss could be rewritten into healing. While medieval Europe chained the mentally ill in dungeons or burned them as witches, a quiet revolution in compassion was unfolding under the domed halls of Baghdad's Bimaristans. These weren't just hospitals, they were sanctuaries where music floated through sunlit courtyards, where patients with psychosis or depression were treated not as cursed but as ill. The 9th-century physician al-Razi, director of Baghdad's famed Muqtadiri hospital, pioneered therapies that wouldn't become mainstream in the West for a millennium. His case notes describe custom-tailored interventions, melancholic patients listening to the rhythmic strumming of the oud, manic individuals calmed by slow-paced drumming, and insomniacs soothed by carefully selected melodic modes known as maqamat. This wasn't entertainment, it was science. Persian physicians had mapped how different musical scales affected pulse and respiration, creating the world's first evidence-based music therapy protocols. What set these treatments apart was their holistic approach. Where European healers saw madness as demonic possession, Persian physicians like al-Razi documented biological and psychological triggers, from brain injuries to grief. Their hospitals featured malaul wards, dedicated psychiatric units with soundproof rooms for agitated patients, aromatic gardens for sensory therapy, and even early occupational therapy where patients wove carpets or copied manuscripts to rebuild focus. One surviving manuscript describes a depression treatment involving 3 phases: vigorous drumming to stir stagnant energies, followed by uplifting flute melodies, culminating in vocal recitations of poetry tailored to the patient's emotional state, a proto-cognitive behavioral therapy session set to music. The Baghdad Bimaristan's real breakthrough wasn't just its methods but its philosophy. Patients were called the guests of God, entitled to kindness and dignity. Al-Razi's famous experiment with 2 identical wards, one where patients received standard care, the other enriched with music, storytelling, and chess, demonstrated better recovery rates in the therapeutic environment. His notes on schizophrenia distinguish between violent and non-violent presentations, prescribing different activities accordingly. Even the architecture reflected empathy. Wards were arranged around central gardens so patients could see greenery, based on observations that nature contact improved moods. Archaeological evidence confirms how advanced these practices were. Excavations at Ray revealed ceramic vessels marked with musical notes and patient responses, suggesting systematic data collection. A 13th-century Persian medical text depicts a harpist performing for a ward of patients, their faces relaxed, a stark contrast to European art of the same era showing the mentally ill in chains. When European travelers like Gerard of Cremona finally encountered these hospitals during the Crusades, they returned with tales of Saracen sorcery that healed minds without exorcism. This legacy still echoes in modern therapies. The Persian concept of sound frequency affecting brain waves predates today's vibroacoustic therapy by 1,000 years. Their use of rhythmic drumming to synchronize neural patterns mirrors contemporary treatments for PTSD and Parkinson's. Most importantly, they proved that mental illness demanded not punishment but understanding, a radical empathy that would flicker and fade in the West until the Enlightenment. Those Baghdad courtyards where music once bridged broken minds remind us that the greatest breakthroughs aren't always about new tools, but about seeing humanity where others saw only madness. The term cesarean section conjures images of sterile operating rooms and fetal monitors, but its roots stretch back to a far more perilous era, one where this desperate intervention often meant choosing between mother and child. While legend claims Julius Caesar was born via abdominal incision, giving the procedure its name, historical evidence suggests Roman physicians were performing these operations long before his time, not as birth methods but as last-ditch attempts to save infants when mothers died in labor. What makes these ancient accounts remarkable isn't just their existence, but their meticulous documentation of both failures and successes. The Roman medical text De Medicina describes using sharpened bronze blades to make midline incisions, with assistants holding the uterus steady as the physician worked swiftly to extract the infant. The survival rates were grim by modern standards, but archaeological evidence tells a more nuanced story. Examination of Roman-era maternal graves reveals some with carefully sutured abdominal wounds, proving that contrary to popular belief, a handful of mothers did survive these harrowing procedures. The real breakthrough lay in their understanding of anatomy under pressure. Roman surgeons recognized that timing was everything. Waiting too long after maternal death risked fetal demise, but operating too early on a struggling mother increased her bleeding risk. They developed crude but effective techniques to control hemorrhage, using clamps fashioned from heated metal to cauterize uterine blood vessels during extraction. Some accounts even describe packing the incision with vinegar-soaked linen to prevent infection, a practice modern studies confirm could kill certain bacteria. What's startling is how closely their emergency protocols mirror today's crash C-sections in battlefield medicine or remote clinics. They knew to tilt the mother's pelvis upward to prevent air embolism, avoided bladder injury by palpating anatomical landmarks, and sometimes administered opium derivatives post-op for pain, though whether this was for the mother's comfort or to ease her passing remains debated. Archaeology provides chilling yet fascinating proof of these practices. A 1st century BC surgeon's tomb near Pompeii contained a specialized kit with a hooked scalpel for uterine incisions, along with a unique double spoon device believed to cradle the fetal head during extraction. Forensic analysis of a young mother's remains from Herculaneum shows a healed C-section scar beneath her burial shroud her pelvic bones, revealing she later delivered vaginally, defying assumptions that these operations always sterilized women. Even more compelling are the infant graves, tiny skeletons buried with amulets against the evil eye, often clustered near maternal tombs with abdominal trauma, suggesting these babies lived hours or days after their surgical births before succumbing to prematurity or infection. Why does this matter today? Because Rome's C-sections represent medicine's eternal dilemma when to intervene drastically in nature's course. Their practitioners walked an ethical tightrope we still tread, balancing maternal risk against fetal survival, tradition against innovation. When a 21st century surgeon performs an emergency section, they're part of a chain that began with those bronze blades and vinegar dressings, a testament to humanity's relentless drive to cheat death, one precarious incision at a time. These weren't just primitive procedures, they were the first flickers of a belief that childbirth shouldn't be a death sentence, a conviction that would eventually save millions. In the bustling courts of 13th century China, a magistrate named Song Sai faced a grim dilemma: how to prove whether a murdered villager had drowned or been strangled before entering the water. The stakes were life and death. An incorrect ruling could send an innocent man to execution. His solution, a meticulous examination using techniques so advanced they would become the foundation of modern forensic science. The resulting manual, Collected Cases of Injustice Rectified, wasn't just a legal document, it was the world's first systematic guide to solving crimes through physical evidence, written in 1248 CE with a clarity that still stuns investigators today. Song Sai's methods read like a contemporary CSI handbook. To distinguish drowning from post-mortem submersion, he instructed examiners to compare lung tissue floating sections indicated water inhalation while alive. For suspected poisonings, he described testing silver needles inserted into victims' throats, watching for oxidation patterns that revealed arsenic or mercury. Perhaps most astonishing was his time-of-death estimation technique, placing maggots from a corpse into a container of dirt and tracking their growth stages against known insect life cycles, a practice entomologists still refine centuries later. Each case in his manual followed rigorous protocol, examining the body in daylight to avoid shadow distortions, documenting wounds with exact measurements, and even prohibiting loud noises near crime scenes to preserve examiner focus. What set Song Sai apart wasn't just his observational genius, but his commitment to empirical truth in an era steeped in superstition. While European courts relied on trial by ordeal, believing God would guide hot irons to spare the innocent, Song Sai dismissed spectral evidence outright. His manual debunked folk myths like corpses bleeding in the killer's presence by demonstrating how temperature and humidity affected decomposition rates. He even warned against coerced confessions, detailing how torture produced false admissions through case studies like a wrongly accused butcher who confessed under duress before new evidence uncovered the real murderer. The manual's legacy lies in its structured methodology. Song Sai organized investigations into 5 phases: scene assessment, body examination, witness interviews, evidence testing, and conclusion verification, a framework mirroring modern forensic protocols. His instructions for exhuming buried bodies specified tools like bamboo scrapers to avoid contaminating tissue, while his bloodstain analysis techniques distinguished arterial sprays from blunt force trauma patterns. Archaeologists in Jiangxi province recently unearthed a magistrate's toolkit matching song-size descriptions, complete with calibrated scales for weighing trace evidence and waxed paper for preserving wound impressions. Perhaps the most poignant breakthrough was his advocacy for the dead themselves. Song Sai insisted every examination begin with ritual offerings to the deceased, writing, "Only by honoring their humanity can we uncover the truth they can no longer speak." This blend of respect and rigor created a system where physical evidence outweighed circumstantial assumptions, a radical notion that would vanish from Western courts for centuries. Today, when a forensic pathologist determines a victim's last moments by analyzing stomach contents or insect activity, they're walking a path first cleared by a 13th-century magistrate who believed justice shouldn't rely on guesswork, but on the unassailable language of evidence written in flesh and bone. Buried beneath the sands of time, a 4,000-year-old Egyptian papyrus holds the earliest known description of a disease we now call cancer. The Edwin Smith Papyrus, dating back to 1500 BC, details a patient with breast tumors so advanced they were described as bulging masses colder than the surrounding flesh, a chillingly accurate clinical observation. What's remarkable isn't just that ancient physicians recognized this condition, but how they grappled with it. The text bluntly concludes there is no treatment, yet adjacent scrolls reveal they tried. Charred residues found in medical jars at the Temple of Kam Ombo contain traces of crushed crocus flowers and arsenic compounds, ingredients modern oncology now knows can slow tumor growth. These weren't random potions, they were targeted experiments documented over generations in hieroglyphic marginalia that showed dosages adjusted based on patient responses. The real breakthrough lies in their diagnostic precision. While other ancient cultures attributed tumors to curses or imbalances, Egyptian physicians categorized them by observable traits. The Ebers Papyrus distinguishes between superficial growths, swellings that can be grasped, and invasive ones, those rooted like lotus fibers, foreshadowing today's benign versus malignant classifications. One haunting passage describes using heated knives to test tumors. If they bled minimally and smelled foul, they were deemed untreatable, a crude but effective precursor to modern biopsy techniques. Archaeologists examining mummies from the period have found skeletal metastases proving these descriptions weren't hypothetical. They were based on real patients whose remains still bear the scars of their struggle. But the Egyptians' greatest contribution wasn't their limited remedies, it was their refusal to surrender to mysticism, where Mesopotamian healers recited incantations to drive out the crab demon. Egyptian texts like the Hearst Papyrus methodically record which plants temporarily shrank certain tumors, even noting that opium relieved pain when cure wasn't possible. A recently decoded wall in the Saqqara necropolis depicts a physician named Imhotep Roman II supervising what appears to be a primitive lumpectomy, with assistants holding retractors shaped like ibis beaks, tools that may have doubled as cauterizing devices. Forensic analysis of the instrument shows traces of copper salts, known today to have mild cytotoxic effects. Why does this matter now? Because these fragile papyri capture medicine's first uneasy dialogue with a disease we still battle. When a 21st-century oncologist administers arsenic trioxide for certain leukemias, they're unknowingly echoing an ancient Memphis healer who ground orpiment pigment into medicine. Those scorched surgical knives and meticulous case notes represent more than failed attempts. They're the earliest evidence of humanity's refusal to accept suffering as inevitable, even in the face of the impossible. 4 millennia later, we've traded papyrus scrolls for genomic sequencing, but the essential struggle remains unchanged: to stare into the abyss of the unknown and still reach for a remedy. The sweat-slicked floors of ancient Greece's gymnasiums weren't just arenas for competition, they were laboratories where the science of sports medicine was born. Walk into a training ground like Athens' famed Lyceum in 400 BC, and you'd find more than athletes honing their bodies. Physicians worked the sidelines, observing how a sprinter's knee buckled after a fall or how a wrestler's shoulder popped during a throw. These weren't casual observations, they formed the foundation of systematic injury treatment, recorded on papyrus scrolls that became the world's first physical therapy manuals. What made Greek athletic medicine revolutionary was its proactive approach. Trainers and healers collaborated to prevent injuries before they happened, prescribing tailored warm-ups for sprinters, dynamic stretches mimicking racing motions, and strength-building routines for discus throwers using leather sacks filled with sand. But when injuries did occur, their treatments bordered on prescient. A sprained ankle wasn't just wrapped, it was iced with snow hauled down from Mount Parnassus, then gradually mobilized through progressive weight-bearing exercises strikingly similar to modern Rice protocols. Galen's notes describe treating torn shoulder muscles with a combination of massage, heat therapy using heated stones wrapped in wet linen, and resistance training with weighted cords, a dead ringer for today's rotator cuff rehabilitation. The gymnasium's real genius lay in its specialized spaces. Separate areas housed treatment tables for joint realignments, heated rooms for soothing sore muscles with steam infused with rosemary oil, and even quiet courtyards where athletes practiced controlled breathing to manage pain. Archaeologists excavating the gymnasium at Delphi uncovered tools that tell a vivid story: bronze scrapers for myofascial release, curved hooks for gently repositioning dislocated fingers, and ceramic vessels labeled with ingredients for anti-inflammatory salves combining olive oil, beeswax, and crushed willow bark. These weren't makeshift remedies, they were standardized treatments, with trainers across Greece sharing techniques through an informal network that functioned like an early sports medicine association. Perhaps most astonishing was their grasp of biomechanics. Without X-rays or MRIs, Greek physicians deduced how repetitive motions caused damage by studying athletes' bodies in motion. They noticed long-distance runners often developed stress fractures in the same metatarsal bones, while boxers exhibited early arthritis in specific knuckles, insights that led to customized sandals with extra ankle support and leather hand wraps with strategic padding. Hippocrates' treatise on joints details a spinal traction device that used a ladder and pulleys to relieve herniated discs, a principle still used in modern inversion tables. This wasn't just medicine for the elite. Inscriptions at Olympia reveal free clinics where retired athletes treated amateurs, passing down knowledge through generations. When a 1st century CE gladiator barracks in Pergamon adopted Greek sports medicine, survival rates for combat wounds skyrocketed, proving these methods worked beyond the playing field. Today, when a physical therapist tapes a knee or designs a plyometric routine, they're channeling the wisdom of those sun-baked gymnasiums, where healing wasn't just about recovery, but about unlocking the body's next level of potential. The Greeks understood something we're still learning. The line between medicine and performance is as fluid as an athlete in motion. While medieval Europe still believed cataracts were caused by humors solidifying in the eye, a brilliant Iraqi ophthalmologist named Amr al-Mawsili was already perfecting a technique that would revolutionize vision surgery using nothing more than a hollow needle. Picture the scene in 11th century Baghdad. A patient seated beneath a sunlit dome as al-Mawsili inserted his ingenious invention, a finely crafted metal tube with a suction plunger directly into the clouded lens. Unlike earlier Persian couching methods that merely displaced cataracts, this syringe actually extracted them, restoring clear vision in a way that wouldn't become standard in the West until the 19th century. What made al-Mawsili's approach groundbreaking was its precision engineering. Surviving manuscripts describe needles so thin they could pass through the cornea without leaving detectable scars, their hollow tips designed to create vacuum pressure when the plunger was withdrawn. His treatise, Choice of Eye Diseases, details the exact angle of insertion between the iris and sclera, to avoid damaging critical structures. Most impressively, he recognized the lens wasn't just a float obstruction but a layered structure, advising surgeons to draw gently as one sips hot tea to prevent rupturing delicate capsules. Archaeological finds in Cairo's ancient medical quarter unearthed kits containing these early syringes alongside magnifying lenses, proving the procedure was widespread across the Islamic world. The technique's real genius lay in its adaptability. Al-Mosley's successors refined the design with glass reservoirs to monitor extracted material, noting differences between soft, milky cataracts in younger patients and hardened, honey-like ones in the elderly. Persian physician Al-Razi documented using the syringe with antiseptic washes of rose water and saltpeter to reduce infection risks, an early form of intraoperative irrigation. Moorish Spain's medical schools even developed a training model using goat eyes filled with egg white to simulate different cataract consistencies. Why did this miracle fade from memory? Ironically, because it worked too well. With high success rates, the technique became so routine that later Islamic scholars focused on documenting complications rather than innovating further. When Renaissance Europe rediscovered cataract surgery through Arabic texts, they misunderstood the syringe's mechanism, reverting to riskier couching methods. Only in 1967, when American surgeon Charles Kellman invented phacoemulsification using ultrasonic vibrations to break up and suction cataracts, did medicine circle back to Al-Mosley's core principle, that removing the obstacle beat merely displacing it. Those delicate brass syringes gathering dust in Damascus museums aren't just relics, they're proof that sometimes the most revolutionary ideas are the simplest ones. In a world still groping through medical darkness, Al-Mosley's needle offered more than restored sight. It illuminated the path forward. While European surgeons of the same era relied on alcohol or brute strength to subdue patients, a healer in the Andes was preparing a far more sophisticated anesthetic, chewing coca leaves and spitting the alkaloid-rich paste onto a warrior's gaping spear wound. This wasn't mere ritual, it was precision pharmacology. By 500 CE, indigenous cultures across the Americas had developed an extensive repertoire of natural anesthetics, leveraging psychoactive plants with such accuracy that modern chemists still study their methods. The Maya, for instance, mixed morning glory seeds containing ergot-like compounds into ceremonial wines for amputations, while Aztec surgeons used datura root to induce twilight sleep during trepanations. What seems like shamanistic practice was actually grounded in generational observation. These healers understood dosages that dulled pain without stopping the heart, a balance Western medicine would struggle to achieve for centuries. One particularly ingenious method emerged in the Mississippi Valley, where healers crafted sleeping mats woven from jimson weed and wild lettuce fibers. Patients undergoing bone-setting procedures would lie on these mats while the healers fanned smoke from smoldering lobelia leaves over them, creating a transdermal anesthetic effect. European accounts from the 1500s describe warriors walking into battle with pouches of coca leaves tucked under their lips, not just for stamina but as battlefield first aid. The leaves' numbing properties could be activated quickly by mixing with saliva, providing on-the-spot pain relief for arrow wounds, but the real sophistication lay in their understanding of synergistic combinations. A recently deciphered Mixtec codex details a three-stage anesthetic protocol. First, a paste of chili and tobacco to stimulate endorphins, followed by peyote tea to dissociate the mind from pain, and finally a compress of crushed coca applied directly to surgical sites. Modern researchers testing this sequence found it blocked pain as effectively as some local anesthetics, with fewer side effects than opioids. Archaeologists excavating a Chachapoya surgical site in Peru uncovered a toolkit that included bone needles, obsidian scalpels, and a mortar containing traces of coca, ayahuasca, and something astonishing: charred seeds from the venomous toad plant, now known to contain a potent muscle relaxant. What sets these practices apart isn't just their efficacy, but their holistic philosophy. Unlike later European anesthetics that rendered patients unconscious, indigenous methods often maintained a dreaming awareness, allowing feedback during procedures. A Cherokee bone setter's journal describes patients guided to sing their pain into the spirit world during reductions, using trance states to self-report discomfort levels. This careful calibration, dulling agony without obliterating consciousness, reflects a nuanced view of pain as information rather than just an obstacle. The tragic irony, these breakthroughs were dismissed as primitive superstition by colonial invaders. When Spanish chroniclers documented Inca surgeons successfully removing infected teeth using coca poultices, they attributed the pain relief to demonic spells. Yet today, the same coca derivatives revolutionized modern dentistry as novocaine, and psychedelics like psilocybin, once used by Mazatic healers, are being rediscovered for surgical anxiety. Those ancient healers didn't just stumble upon these plants, they engineered them into a science of relief, proving that sometimes the most profound medical wisdom grows not in laboratories but from the earth itself. In the hushed chambers of Byzantine birthing rooms, where flickering oil lamps cast shadows on silk-draped walls, a revolution in childbirth was unfolding, one that balanced the sacred with the startlingly scientific. Aetius of Amida, court physician to Emperor Justinian in the 6th century, didn't just record midwifery practices, he transformed them into a precise art. His manuscripts reveal brass instruments resembling modern forceps, their curved blades padded with linen to cradle an infant's head without crushing delicate skull bones. But these weren't crude tools of desperation, they were part of an elaborate system where every intervention followed careful observation. Before reaching for metal, midwives trained in Aetius methods would assess labor progression by palpating the mother's abdomen in specific quadrants, mapping the baby's position with a tactile precision that predated ultrasound by 14 centuries. What set Byzantine obstetrics apart was its holistic approach to complications. Aetius described maneuvers for breech births that sound eerily contemporary, flexing the knees to prevent arm entanglements, supporting the perineum with warmed olive oil to reduce tearing, even using hooked fingers to gently guide a stuck shoulder. His texts detail emergency procedures like symphysiotomy, carefully widening the pelvic joint with a blade when labor stalled, a last resort technique still used in some remote areas today. But the real innovation lay in the birthing chair. Unlike the flatbeds common elsewhere, Byzantine designs featured adjustable backrests and foot stirrups, allowing gravity to assist while granting midwives better access. Excavations in Ephesus uncovered one such chair with metal fittings for attaching pulley systems, suggesting some practitioners may have attempted controlled traction during difficult deliveries. The instruments themselves were marvels of metallurgy. Aetius forceps, likely adapted from Roman surgical tools, had fenestrated blades to reduce pressure on the infant's head. Archaeologists in Thessaloniki found a similar set with rotating handles that locked at different angles, allowing midwives to navigate the birth canal's curves. These weren't one-size-fits-all devices. Aetius emphasized selecting tools based on the mother's anatomy, even providing measurements for determining proper blade width by feeling the distance between pelvic bones. His pain management techniques blended practicality and psychology, aromatherapy with lavender and chamomile oils, hypnotic chanting in rhythmic patterns, and a unique warm sandbag method where heated pouches were pressed against the lower back to relax muscles. Perhaps most striking was the emphasis on maternal autonomy. Byzantine midwives documented informed consent practices where options were explained through silk-embroidered birthing charts showing different scenarios. A 9th century illustration from the Vienna Dioscurides depicts a woman pointing to her preferred position while a midwife demonstrates forceps on a doll, an early example of patient education. Postpartum care was equally advanced, with herbal sitz baths to speed healing and breast-binding techniques to manage milk supply. When archaeologists analyzed stains on a midwife's kit from Antioch, they detected traces of ergot fungus known today to contract the uterus, proof that these practitioners harnessed pharmacology alongside mechanics. This wasn't just medicine, it was a profound reimagining of birth's dangers and dignity. ETS legacy lingers in every modern delivery room where technology meets tenderness, where centuries-old wisdom whispers in the choice between forceps and hands, between intervention and patience. Those Byzantine midwives, with their polished brass tools and oil-stained manuscripts, understood something we're still learning, that the safest births often happen at the intersection of skill and reverence. While European medicine still blurred the lines between priest and physician, China's Han Dynasty was pioneering a radical idea, that healing required not just knowledge but focus. Walk through the halls of a 2nd century BC imperial hospital in Chang'an, and you'd encounter something unheard of in the ancient world: color-coded corridors leading to dedicated wards for internal disorders, surgical cases, and dietary therapies. This wasn't just organizational convenience, it represented a seismic shift in medical philosophy, recognizing that the body's ailments demanded specialists just as a crumbling city wall required separate engineers for foundations and battlements. The Imperial Medical Bureau divided its physicians into 3 distinct branches, each with rigorous training protocols. Internal medicine experts, clad in indigo robes, diagnosed systemic imbalances through pulse reading and developed tailored herbal regimens. Across the courtyard, surgeons in crimson tunics honed their craft on bamboo models before performing procedures from abscess drainages to tumor removals, their tools sterilized in boiling vinegar between operations. Most revolutionary was the nutrition department, their saffron-colored sashes marking them as masters of food as medicine. These specialists prescribed personalized diets based on seasonal availability and the patient's constitutional type, creating meal plans that balanced the 5 flavors to address specific deficiencies. Archaeological evidence reveals how deep this specialization ran. Excavated bamboo slips from a Han-era medical archive detail case histories where surgeons consulted internalists before operating on frail patients, or nutritionists adjusted recovery diets based on a surgeon's post-operative notes. One particularly striking record describes a diabetic noblewoman whose treatment team included a surgeon to drain her foot ulcer, an internalist to regulate her wasting thirst syndrome with bitter melon extracts, and a nutritionist who eliminated sweet grains from her meals, a multidisciplinary approach startlingly similar to modern diabetes care. The system's genius lay in its structured knowledge transmission. Each specialty maintained its own library of case scrolls, updated annually from provincial reports. Surgical trainees practiced stitching on layered silk pouches filled with rice to simulate tissue resistance, while internal medicine students memorized thousands of herb-drug interaction warnings. Nutritionists underwent particularly grueling exams identifying hundreds of ingredients blindfolded by taste and smell, then justifying their therapeutic uses. This wasn't just theoretical. Tomb murals from the era show physicians in differently colored robes collaborating around bedsides, some checking pulses while others prepared poultices or adjusted meal trays. What made Han specialization so effective was its fluid boundaries. While physicians trained deeply in one area, they shared a common language of diagnostics. A surgeon might detect liver chi stagnation during a gallbladder procedure and refer the patient to an internalist, just as a nutritionist recognizing signs of intestinal obstruction would immediately summon a surgical team. This interoperability anticipated modern hospital workflows by 2 millennia. When excavations at a Han military outpost uncovered a field hospital's remains, the findings were staggering: separate treatment areas connected by covered walkways, with surgeon burials containing bronze retractors alongside internalists' herb grinders, all arranged to facilitate rapid consultation. The legacy of this system pulses through every modern specialty clinic. Those color-coded hand robes foreshadowed today's scrubs, differentiating surgeons from cardiologists, while their case conferences mirror tumor boards reviewing cancer treatments. Most importantly, they proved that dividing medicine wasn't about fragmentation. It was about deepening expertise to serve the whole patient better. In an age where healers everywhere else still attempted to master all arts, the Han Dynasty grasped a truth we're still honoring. Sometimes the best way to see clearly is to focus narrowly, then share the view. In the bustling streets of 10th century Baghdad, a physician named Al-Razi did something revolutionary. He wrote down rules, not just medical procedures, but ethical principles that would transform healing from a trade into a sacred trust. His ethics of the physician didn't just advise doctors to wash their hands. It demanded they guard their patients' secrets as fiercely as their own, respect the poor and wealthy alike, and most radical of all, never claim certainty where doubt existed. This wasn't just professional etiquette, it was the birth of medical ethics as we know them, codified 6 centuries before Europe's Hippocratic oath regained prominence. Al-Razi's genius lay in grounding morality in practicality. Consider his stance on patient confidentiality. While others saw gossip about noblemen's ailments as harmless, he recognized the ripple effects. A merchant denied credit if his heart condition became known, or a woman shunned for infertility. His solution, a strict hierarchy of truth-telling: disclose only what the patient permits, and even then, only to those who must know. Archaeologists digging at the ruins of Baghdad's Al-Adudi Hospital found consultation rooms designed with sound-dampening curtains and staggered entrances to prevent eavesdropping. Architectural proof these weren't abstract ideals but lived practices. But his boldest break from tradition was his insistence on evidence. In an era when senior physicians dictated treatments unchallenged, Al-Razi urged students to question everything. One famous account describes him testing prevailing theories about meningitis by dividing patients into groups, some given standard bloodletting, others treated with rest and hydration. When the latter group recovered faster, he publicly abandoned dogma despite the backlash. His clinical notes read like modern case studies: symptoms, interventions, outcomes, and crucially, admissions when a remedy failed. This transparency was unheard of. Medieval Persian manuscripts often show later physicians scratching out phrases like "I do not know" from older texts to preserve authority. What makes these ethics endure isn't their antiquity, but their modernity. Al-Razi's rule against exploiting patients financially foreshadowed today's conflicts over medical billing. His requirement to document errors predated modern malpractice transparency by a millennium. Even his nuanced approach to terminal illness, balancing hope with honesty, mirrors contemporary debates about end-of-life care. When Islamic hospitals introduced written consent forms in the 12th century, they cited his principle that no hand touches a body without its owner's permission. The ultimate testament to his vision, how seamlessly these ideas bridge cultures and eras. Modern hospitals still wrestle with his core dilemmas: when to prioritize privacy over public health, how to balance experience with innovation, where to draw the line between confidence and arrogance. Those Baghdad consultation rooms, with their hushed voices and careful curtains, remind us that the greatest breakthroughs aren't always about tools or techniques, but about the courage to say, "I was wrong," or "This is yours to decide." In a world where medicine often feels coldly technical, Al-Razi's ethics whisper a timeless truth: healing begins not in the hands, but in the honor of the one who holds them. What if everything we think we know about ancient medicine is upside down? These 30 breakthroughs shatter the myth that our ancestors relied on guesswork and superstition. From Inca brain surgery with survival rates rivaling modern hospitals to Persian clinical trials that predated the scientific method by 1,000 years, we've seen civilizations turn crisis into innovation with nothing but keen observation and relentless curiosity. The real revelation, our so-called modern medicine, is often just ancient wisdom rediscovered, whether it's acupuncture triggering endorphins or Egyptian honey bandages outperforming synthetic antibiotics. Take a moment to reflect on these stories not as historical oddities, but as chapters in medicine's unbroken story, that prosthetic toe crafted 30 centuries ago. Its ergonomic design principles still guide biomechanical engineers today. Al-Razi's insistence on evidence-based treatment in 9th century Baghdad laid the groundwork for every double-blind study you've ever heard of. Even the humble aspirin in your medicine cabinet traces back to Greek athletes rubbing willow bark on sore muscles. These weren't lucky accidents. They were systematic, repeatable solutions born from generations of trial, error, and meticulous record-keeping. Here's what changes when we see ancient healers as equals rather than curiosities. We start recognizing that progress isn't always linear. Some of their techniques, like Mayan dentists using gemstone fillings or Chinese variolation against smallpox, were more effective than anything available in 18th century Europe. Others, like Roman sanitation systems, wouldn't be matched until the industrial age. This isn't about romanticizing the past, it's about acknowledging that brilliance transcends technology. A Bronze Age surgeon resetting a fracture with woven splints understood biomechanics just as profoundly as an orthopedic specialist with titanium rods. They simply worked with different tools. So the next time someone calls ancient medicine primitive, remember the Persian cataract needles that restored sight with millimeter precision, or the Byzantine midwives whose birthing tools look eerily familiar to today's obstetricians. History's greatest healers didn't have CT scanners or antibiotics, but they had something equally powerful: the courage to question, innovate, and pass their knowledge forward. Now it's your turn. Which of these breakthroughs left you awestruck? Drop your pick in the comments, and let's keep unraveling medicine's untold stories together. Because the past isn't just prologue, it's a living conversation, and we're all